We're back again with Pierre Rocher, a men's health physio. So, Pierre, what are the essentials that you feel a person needs to know who's undergoing a prostatectomy?
Hi, Joe. Thanks for having me back. So I think in my practice, I see a lot of men who are surprised. They are surprised with the effects that the prostatectomy has had on them. And it's an interesting thing because you have your cancer treated or surgically removed. So there's this period of time where you are very happy and your cancer's being removed and treated. But then the reality sets in that you have these side effects, and different men take it in different ways. So the essential things I think that men need to know is they need to know that every patient is different. You cannot compare yourself to another patient or another male who's had the same procedure, even if it's been the same surgeon. You need to read up and you need to get as much knowledge on a prostatectomy beforehand. In the ideal world, we would love every patient to have a second opinion and to start the process of strengthening their pelvic floor and knowing what's going to happen at least 30 days before their surgery. That often doesn't happen. So that's a big thing. It's the preparing yourself for what's going to happen, dealing with the shock and often the anger of what you are left with after you've been treated for your prostate cancer. But what I can say to every patient is that the surgeons are often, they're very gentle when they break the news to you that there may be some consequences and there may be some incontinence and there may be some erectile dysfunction. And I think it's important to get information on the various treatment options and the various consequences of different treatment options, because there are treatment options that will have a definite consequence of certain sexual dysfunction aspects. And then there are others that will not have the same consequences. And you need to decide and it's up to every patient to decide on their own with the help of the urologist, of course, and possibly the information being shared with their partners, their wives, or their sexual partners. What is the best for you? So we know every patient who undergoes a prostatectomy will have incontinence. That is almost a given fact. We know that can improve, but it takes time. And we know that that's a major issue in the beginning. So you're going to be incontinent. So you should know that there are incontinence pads available at your local pharmacy. You should know how to use them, to insert them. You should know how to discard of them. So those are important little things that can help you to avoid embarrassment. I like to wear my educational hat with my patients and educate them on what kind of clothing to wear. So for instance, if you wear black pants and you have a bit of a leak of urine, it won't show on black pants. Things like that in public. What to drink. If you're going to go and have alcohol, certain things are worse for you, like beer, where certain things are better for you, like whiskey, for instance. So to know that there's an impact and to be prepared and to kind of like face the consequences head on. And then, of course, the big major one is sexual dysfunction. And there's some weird and wonderful consequences, unfortunately, for men when it comes to sexual dysfunction. And some of those may be a shock to patients if they weren't prepared for those. Some of those include aspects relating to the shape and the size of your penis, which may change. For some guys, that's a major shock. And then there may be other things like changes in how you experience an orgasm. And then, of course, an ejaculation, which is a lack of ejaculation, which is almost a consequence for the guys that have a prostatectomy. So to me, it's to have patients should have full disclosure of what's going to happen. And that's not always given to them by their surgeon because of time constraints and things like that. So you need to take responsibility and educate yourself, read books, read blogs, follow Facebook platforms like this one to educate, speak to other patients. A good surgeon will give you the details of his previous patients to contact and to talk to. And I've seen many surgeons happily share the details of their patients. And then there's other platforms to follow. So educate yourself, prepare yourself, don't go in blindly, because what happens after life after prostate cancer needs to be managed by you and your partner, and the help of people like us who are interested in your recovery.